first, I want to thank you all for being here at this hour, and I appreciate it. I support all your amendments, and I think people are tired of us saying that we can't fix problems. I mean, people want us to fix problems. They want us to clean up corruption. They want us to make sure people have health care. They want us to respect our veterans. They want the Epstein files released. And we, and what's happening around here is you got a lot of people who are trying to have the, do the double talk. Yeah, I know I'm with you, but we can't do it because of this, or we can't do it because of that. I mean, and so then nothing ever gets done. And I just want to say one thing about, there's been a lot of kind of negative talk about the Affordable Care Act, but I do want to point out, I mean, look, I believe we need a very different health care system in this country. But I do want to point out some of the good things about the Affordable Care Act. Again, it's polling at 64% favorability. Donald Trump is at 37% favorability. But just so people understand, the Affordable Care Act stops health insurance companies from charging sick people more in premiums than healthy people. It keeps those same health insurance companies from denying coverage to pregnant women, people with pre-existing medical conditions, or because of a person's medical history. It prohibits the health insurance industry from setting an annual or lifetime limit. It demands insurance companies cover most preventative services. It gives states the flexibility to expand their Medicaid programs, which 40 states have done. It provides financial assistance to working people to make health coverage more affordable. And it allows young adults to stay on their parents' insurance plans until they're 26. And those are just some of the provisions within the ACA that make it, quite frankly, popular with a lot of people. I wish the ACA went further. Some of us went during the debate, fought for a public option. We got frustrated by some of our colleagues in the Senate. But I just want people to understand that's what the ACA does. And again, I don't think, I would like to think that none of them are controversial. I don't know why my Republican friends don't like those things, but let me just say also, in addition, the last time Democrats were in control, we built on the progress made with the ACA. We allowed Medicare to negotiate prescription drug prices for the first time in history, saving both Medicare and the American people billions of dollars. Democrats capped the cost of insulin at $35 per month. We made signing up for health care coverage easier and more affordable. Democrats lowered premiums by an average of $800 per person per year. And over 4 years, nearly 12 million more Americans signed up for insurance on the ACA marketplace, bringing the total up to nearly 24 million in 2025. And so, I think my Republican colleagues have made this case as they've attacked us for these, for calling for the extension of the ACA, enhanced credits, is that we have always been a champion for providing additional assistance to help make health care more affordable for people. They have been on the other side. I want to thank them for reminding the American people that we're always on the side of trying to lower their costs and not reducing the quality of their care. And I just want to say one other thing, and I appreciate the chairwoman, getting animated over the fact that the Republicans were basically not around for 7 weeks. I mean, the Speaker of the House basically abolished the House of Representatives during a time when, quite frankly, people are frightened to death over losing their health care premiums. And it really bothers me that there's not much support. So if Republicans are going to screw people over, at least they should show up. And they haven't worked for 8 weeks, they should show up. I move to adjourn, Madam Chair. People ought to show up at the hearing on health care.
Mr. McGovern has made a motion to adjourn. Question is on the motion to adjourn. All those in favor say aye.
Aye.
Aye. All those opposed, no. No. In the opinion of the chair, the noes have it. Mr. McGovern is going to request a recorded vote.
Yeah,
A recorded vote is requested. The clerk will call the roll.
Mrs. Fischbach? No. Mrs. Fischbach, no. Mr. Norman? Mr. Roy? No. Mr. Roy, no. Mrs. Houchin? Mrs. Houchin, no. Mr. Langworthy? No. Mr. Langworthy, no. Mr. Scott? No. Mr. Scott, no. Mr. Griffith? No. Mr. Griffith, no. Mr. Jack? No. Mr. Jack, no. Mr. McGovern?
Aye.
Mr. McGovern, aye. Ms. Scanlon? Aye. Ms. Scanlon, aye. Mr. Neguse? Aye. Mr. Neguse, aye. Ms. Leger-Fernandez? Aye. Ms. Leger-Fernandez, aye. Madam Chair?
No.
Madam Chair, no.
Clerk will report the total.
4 yeas, 8 nays.
The motion is not agreed to.
Now everybody's here, good, okay. I yield back.
Does any member on the Republican side wish to ask a question of the panel? No. Ms. Scanlon, you're recognized.
Thank you, and I wanted to thank all the witnesses for coming in, particularly to talk about the stories of your constituents, because some of our colleagues don't seem to have heard from their constituents about the really drastic price increases that they are being subjected to. And thank you for the amendment with respect to funding the toxic substances with the PACT Act and addressing a whole variety of issues that we wish we were talking about and addressing at this juncture. So really appreciate the work that everyone's put into this and hope that all the amendments are made in order so we can get full and fair debate and votes. I yield back.
Thank you, Ms. Scanlon. Mr. Neguse, you're recognized.
Thank you, Madam Chair. Before my friend from Georgia steps out,